The women portrayed in this video are not actors, but have volunteered to share their own real-life stories to help others. Their message is that it's important to be tested for HIV if you are pregnant or thinking about becoming pregnant, and that if you are HIV positive, you should be treated during pregnancy to protect your unborn child from infection.
Do you? Frog. Over on the other side. I see.
Rebecca and Dan seem like a typical couple out on a family picnic, but they're not. Something that happened 15 years ago cast a shadow over their lives.
I was 21 when I got together with my boyfriend in college, and it was probably 4 months into the relationship. I got very, very, very sick. I had a fever and sores in my throat and lost weight.
Rebecca recovered and forgot about her illness. Then, in 1990, her best friend asked her to go with her for an HIV test.
She called me and said, I made an appointment to get tested, but I'm really scared to go. And I said, oh, you'll be fine, I'll go with you.
Rebecca's friend tested HIV negative. Rebecca tested HIV positive. She was devastated.
The first thing that I thought was, I'll never be able to have children. And then I thought, if I have it, Dan's got it too.
I hope they stay in their room.
When Dan tested negative, Rebecca knew she had been infected before they had met.
I felt fine, I looked fine. My husband was healthy, I was healthy. I hadn't seen this ex-boyfriend in forever, so I didn't know that he was sick.
Rebecca and Dan longed to have children. For 5 years, they were afraid to take the risk.
We educated ourselves. We became kind of experts about HIV.
I meditated, I prayed, I went to therapy, I talked to women who had infected children, women who had uninfected children, and finally made the decision to get pregnant.
Rebecca is one of many HIV-positive women who have chosen to have a child. In the U.S., about 6,000 babies are born every year to mothers with HIV.
Okay, just go ahead and take a listen to your lungs and make sure everything's okay there. Okay.
Many of these women choose to be treated for HIV with AZT and antiretroviral drugs during their pregnancy. Antiretroviral drugs are used to treat HIV infections. AZT has been shown to reduce transmission of HIV from mother to child by almost 70%.
I always had this fantasy that I would be the perfect pregnant woman and I wouldn't drink coffee and I wouldn't smoke and I wouldn't drink alcohol. So the idea of taking a powerful medication that makes some people very sick was very scary to me.
Rebecca did decide to get treated while pregnant and during delivery of the twins. Elective C-sections are recommended for some HIV-positive women to protect their babies from infection during delivery. Rebecca's C-section was performed to help the twins' birth.
Are you ticklish?
When Sarah and Sophia were born, Rebecca was concerned they might be infected. To Rebecca's relief, after 14 months, doctors confirmed that the babies were HIV negative. Today, new tests allow doctors to confirm whether a baby is HIV negative or positive as early as 4 weeks.
I just feel like they're these two miracles. I really do. They're just... I look at them and I can't believe they're here and that they're mine and they're so beautiful.
When Raven was born, her mother Michelle didn't know that she and her baby were HIV positive. In 1990, Michelle was living in a crack house with her ex-husband, 4-month-old Raven, and her son Rondell, when she decided she needed help for her cocaine addiction.
I was crying, and I saw this ad on the train that says, if you or someone that's living in your house who's using drugs and you need help, call this number. And I called the number.
At the rehab center, Michelle got counseling and an HIV test.
My results came back and I tested positive. To be honest, I was not devastated, but I was very scared because I knew I had these 2 children at home.
Brenda.
What?
Hurry up.
Rondell tested HIV negative. Michelle's ex-husband tested HIV positive. But it was Raven's testing HIV positive that changed Michelle's life.
I went and I got rid of the drugs. And from that day on, I just decided I'm going to do everything possible to help this child.
With the help of the rehab center and a support group, Michelle is drug-free and now works as an HIV counselor. Since 1990, both Michelle and Raven have been under the care of HIV specialists and have been treated with HIV medicine.
So did you take your medications yet?
For dinner?
For Raven, taking medication is sometimes hard.
The blue one that I take is kind of big. It gets stuck in my throat sometimes.
Alrighty, I'm gonna have to take out about 3 centimeters because of your due.
She has excellent clinical response from her meds, but there are other infections that is still manifesting in her. And at times it's overwhelming for me to see her go through that.
Your heart's beeping.
Michelle feels that if she had known she was HIV positive in time to be treated during her pregnancy, Raven could be healthy today.
I was never offered counseling. I was never spoken to about me being HIV positive, or even being at risk because of my drug use. If I had known my status while I was pregnant, I would have participated in this study to prevent this virus from going on to my child. But I never had that option.
Today, as an HIV counselor, Michelle makes sure other women do have an option. She tells them to ask their doctors for an HIV test during their pregnancy.
My job helps a lot because I'm helping women and children that were in my situation. I'm seeing them getting help.
Flor seems like a typical pregnant mom, a little anxious but excited too about her new baby's arrival. She's already picked the name, Ignacio, after his father. Yet, when Flor learned she was pregnant, she was horrified.
I couldn't sleep, I couldn't eat well. I felt that I wanted to be alone, isolated. I was also feeling really guilty because I was saying, I'm supposed to be happy.
¿Cuánto aceite le vas a poner?
There was reason for her concern. Flor and her partner, Ignacio, are HIV positive.
Kind of sank in that, what does this really mean, for Flor, for me, and for the baby.
Ignacio and Flor met at an HIV support group soon after they lost their spouses to AIDS. Flor's pregnancy resulted from a condom mishap. Her doctor recommended she receive medicine for HIV during her pregnancy to protect her unborn child from infection.
I was scared because I didn't know how the medication was going to affect the baby, and I didn't know how that was going to affect her as well.
I look over here and you have another 55 over here.
Then the couple heard about a new study that helped them decide for treatment. The study followed babies born to HIV-positive women who had taken AZT during pregnancy for up to 6 years. Those babies showed no signs of side effects.
I'm really happy to say that I've been doing really good about taking my medication. And I don't get any side effects. I haven't had any problems with it.
The well-being of the baby depends on her emotional support. So I try to be there for Flor most of the time.
He accompanied me to all of my prenatals and any other appointments that I have. And so I feel very supported in that sense. I'm not going to breastfeed because I know of the high risk of transmitting HIV through breast milk to the baby. For me, that's a sad thing because it was one of my dreams to be able to breastfeed my own child. but it's a sacrifice that I'm willing to go through for my baby's health.
Rebecca, Michelle, and Flor all love their children and have made important choices to protect them. If you are pregnant or think you might become pregnant, even if you have been tested before, get tested for the HIV virus. It could help protect your unborn child from HIV infection.
I was lucky that my friend was going and that she asked for support when she did, because it gave me a chance to protect my husband. He's still negative. It gave me a chance to really think about whether I was going to have children. And when I did decide to have children, it gave me a chance to protect them.
Choosing to get treated with a combination of AZT and other kinds of HIV medicine while you're pregnant can improve your own health and also reduce your baby's chances of being HIV infected by almost 70%.
I don't know if my child is going to be HIV negative, but I'm doing everything within my power to follow my antiretroviral treatments so the baby will, the chances that the baby will become HIV positive will be lower.
All of us are at risk. Families from urban and rural areas, grandparents, young single people, and babies. AIDS is now one of the leading causes of death among women aged 25 to 44 in this country, and the rate of infection is increasing. Testing for HIV is now standard in most health clinics and doctors' offices. Doctors now recommend that all pregnant women be tested for HIV, even those who feel they are not at risk. Pregnant women who are not offered an HIV test should request it from their doctor. The good news is that a woman who is pregnant may qualify for Medicaid even if she did not qualify in the past. Medicaid covers counseling, testing, and treatment for the mother and her baby.
I wish I had known I was HIV positive when I was pregnant with Raven. I could have taken treatments to prevent this virus from going on to Raven. But it's not too late for you. You can get tested for the HIV virus, especially if you are pregnant. You should get tested for the HIV virus. And if you are positive, you can take treatments today to prevent this virus from going on to your child. And you can take treatments that can give you and your baby a longer lifespan.
Doctors have been able to confirm that Flor's baby's son is HIV negative. The Healthcare Financing Administration urges all persons who are HIV positive not to engage in sex without using a condom. Having unprotected sex carries a high risk of transmitting HIV. According to the Public Health Service and the American College of Obstetricians and Gynecologists, HIV counseling and voluntary HIV testing is now the standard of care for all pregnant women.